is Michelle Reynolds, and I am a state senator from Ohio and serve as co-chair of the Council of State Governments Midwestern Legislative Conference Corrections and Public Safety Forum. I will be helping lead and moderate this webinar with the assistance of my fellow forum co-chair, Wisconsin Senator Jesse James. Before we start, I'd like to remind everyone that this webinar is being recorded, and both the recording and the presenter slides will be available by tomorrow on the CSG Midwest website at www.csgmidwest.org. We will wait to answer questions until after the presentation is completed, but you are welcome to type your questions into the Q&A feature as you think of them. And now I would like to introduce today's webinar topic. Every year, hundreds of thousands of people leave incarceration, facing enormous barriers to housing, employment, healthcare, and education. At the same time, states are grappling with workforce shortages, rising homelessness, and increased public safety demands. Without a coordinated approach to reentry, these interconnected challenges persist, costing states an estimated $8 billion annually in reincarceration costs alone. This webinar will explore how Reentry 2030 can help meet these challenges. Reentry 2030 is a bold, state-led initiative to dramatically improve outcomes for people returning from incarceration and those under supervision. Launched by CSG Justice Center, it provides a comprehensive framework to help states develop solutions for their unique needs. During this webinar, we'll hear from two experts from the Council of State Governments Justice Center about Reentry 2030 and how your state can participate. I'd like to bring in my colleague, Wisconsin Senator Jesse James, to introduce our presenters.
Thank you, Senator Reynolds. Nina Solomon leads state engagement efforts for the Justice Center's Corrections and Reentry Division, including the Improving Outcomes for Youth Initiative and Reentry 2030. She also coordinates state policy change initiatives with other divisions. Nina has headed up juvenile justice policy initiatives leading to legislative changes in multiple states and spearheaded Reentry 2030 launches across the country. She was also the lead author of the School Discipline Consensus Report. Previously, Nina was a policy advisor at Education Council LLC, a national policy and legal consulting firm, and an investment associate at the Chicago Public Education Fund. She also conducted research and wrote policy briefs and funding guides to support education and youth development programs and worked in government relations for a national youth development organization. Nina earned a BA in political science from the George Washington University and a Master of Science degree in education policy from the University of Pennsylvania. Megan Pfeiffer leads technical assistance for the Reentry 2030 initiative. She also has supported state and local criminal justice agencies in implementing programs for incarcerated parents and their children and for people returning home after incarceration. Previously, Megan worked as a program director on Rikers Island in New York, where she developed and oversaw the program's visiting, parenting, counseling, and advocacy services. She is a licensed social worker with over a decade of experience providing services to survivors of gender-based violence and people impacted by the criminal and family court systems. She received her MS in social work from Columbia University, an MS in criminal justice policy from the London School of Economics, and a BA in history from the University of Michigan. I'd like to welcome Nina and Megan.
Thank you, Senator Reynolds and Senator James, for that introduction and for the opportunity to discuss one of the most critical public safety and fiscal challenges facing states today. When we talk about reentry, it's really easy to view it strictly as a corrections issue, but its impacts ripple far wider. It directly shapes workforce participation, local housing, and the health and wellness of communities. Nearly everyone who enters prisons will eventually return home. And so the question is not whether people are returning, but how well we've prepared them to succeed when they do. And successful reentry is one of the most effective public safety investments states can make. Next slide, please. To give some context on who we are, the Council of State Governments Justice Center helps leaders in every state design and implement solutions for complex justice system challenges. We've provided technical assistance to hundreds of jurisdictions across the country to implement evidence-based reentry practices and policies to improve public safety. A significant portion of this work is supported through the Second Chance Act, which was bipartisan federal legislation that represented the first major federal investment specifically focused on reducing recidivism. Through our work managing the National Reentry Resource Center, we've supported jurisdictions nationwide in implementing these strategies, and we've tracked what works in practice across all 50 states, and we share those lessons directly with policymakers and practitioners. And recently, we launched Reentry 2030, a national state-led initiative to help states coordinate unified system-wide approaches to reentry success, which my colleague will speak about in a little. Next slide. A major pillar of our work is helping states expand economic mobility for people with criminal records. To help states navigate this, the CSG Justice Center maintains the National Inventory of Collateral Consequences of Conviction. It's an online searchable database of all the statutes and regulations across all 50 states that limit access to rights, benefits, and opportunities due to a person's criminal conviction history. We use this data to work directly with state leaders on a bipartisan basis to identify and address barriers to employment, occupational licensing, and education. And through our Fair Chance licensing project, we provide technical assistance to states looking to reform fair chance licensing laws. And next slide, please. Beyond economic mobility, we equip state leaders with practical, actionable toolkits to drive change. Our national policy and practice guidance for the future of reentry presents a roadmap of reentry policy and practice options that state leaders can champion, invest in, or enact to make successful reintegration a reality for every person returning home from incarceration. We have research on national state level recidivism trends and the costs associated with unsuccessful reentry. And our Beyond Recidivism resources help states measure success beyond recidivism across other critical economic and social milestones such as housing retention, stable employment, and treatment. Next slide, please. So across the country, states consistently identify similar challenges affecting people returning home from incarceration. Next slide. These barriers often arise from system design. A person leaving prison often interacts with multiple agencies, from community supervision, workforce, housing, treatment, but each agency operates independently under different eligibility criteria and processes. Even the most highly motivated people can still struggle to navigate this complexity. We also find that many successful programs remain isolated and only serve a fraction of those who need the assistance and are not nearly funded at scale, system, and statewide. A major challenge is not simply creating the effective programs, but creating the statewide systems capable of delivering those programs consistently and sustainably. Next slide, please. People returning from incarceration also face significant challenges related to housing, health, education, and employment. People who have been incarcerated are 10 times more likely to experience homelessness than the general population and face significant barriers accessing housing. It becomes a cyclical relationship. People experiencing homelessness are also at an increased risk of reincarceration due to violations of supervision, more frequent interactions with law enforcement, and rearrests for low-level offenses that are often related to their experience of homelessness. Individuals with behavioral health disorders are also disproportionately represented in correctional populations and tend to stay longer in jails and prisons with the same charges and sentences as their peers because they don't do as well in these settings. We are seeing an increasing number of people who have opioid addictions, and people released from prison are 40 times more likely to overdose upon leaving incarceration than the general population. Many people also enter prison with unmet health needs and have higher rates of chronic health conditions. Corrections agencies are responsible now for caring for an increasingly aging population. There is widespread evidence that incarceration is associated with accelerated aging, where due to an increased exposure to a variety of risk factors for poor health, which includes incarceration itself, individuals often present as 10 to 15 years older than their chronic age. And we see higher rates of disability, chronic health conditions, and complex healthcare needs. People releasing also have limited education and higher than average unemployment rates. While over 2/3 of people in prison do have a high school credential, only 6% have a post-secondary degree. And combined with a criminal record, which comes with a 50% reduction in callbacks and job offers, finding a job becomes an uphill battle. Next slide, please. Tackling these challenges one by one ignores a singular opportunity to make a dramatic impact on outcomes across social service systems. These needs often go unmet due to a lack of coordination between systems, making it difficult for individuals to navigate and access services. Addressing each challenge separately misses opportunities to improve these outcomes across systems. And we know these challenges don't exist in isolation from each other. A person cannot maintain stable employment if they don't have a place to sleep, and employment increases housing retention. Next slide, please. Every unsuccessful reentry represents both a public safety challenge and a taxpayer expense. And reentry impacts a large segment of the US population. Over 450,000 people were released from state and federal prisons in 2023 alone, joining an estimated 5 million formerly incarcerated people living in our communities across the United States. Nationally, recidivism rates remain substantial. And while some states have made progress, others have seen increases in reincarceration rates over the last decade. And this is a high cost. Nationally, states spend $8 billion annually on reincarcerating people. Next slide, please. There are over 40,000 collateral consequences that continue to affect people long after they have completed their sentence. Collateral consequences are legal restrictions that limit or prohibit people convicted of certain crimes from accessing various rights, benefits, and opportunities. They are not part of a criminal sentence, but are embedded throughout state and federal law. They affect employment, occupational licensure and certification, education enrollment, access to financial aid, housing, including applying for rental properties and eligibility for public housing, public benefits, including SNAP, child custody, and civic participation, such as voting and jury service. Nationally, over 70% of all collateral consequences impact employment opportunities. Many of these are imposed automatically, and 80% last indefinitely, meaning they remain in effect for the duration of a person's life, absent relief in the form of expungement. Employment-related consequences impact a range of fields and industries, but the healthcare industry is the most affected by collateral consequences. Employment-related consequences exist in three ways. First, they can limit the ability of employers to hire workers with convictions, so giving employers the ability to make these decisions themselves. Second, they restrict access to essential occupational and professional licensing. And third, they restrict accesses to licenses needed to start a business. I'll note that legal barriers are only part of the challenge. There's also a wide range of informal barriers, including employer and landlord and property management stigma, which create additional obstacles for folks to access these resources and opportunities. Next slide, please. And now I will pass it to my colleague Nina to talk a little bit more about how Reentry 2030 is addressing these challenges.
Thanks, Megan. So as Megan described, we know that there are a lot of challenges that individuals are experiencing as they are reentering back into their communities. But we also know that a lot of great work is happening around the country in many jurisdictions in your states to support individuals that are reentering. And we generally know what works from the research and from decades of work in this field on what actually works to improve reentry outcomes. But it's not happening at the scale necessary, and it's not often happening in a coordinated way. Reentry 2030 is about scaling up what works, from educational programming to skills training, behavioral health services and substance use treatment, getting folks connected to jobs, supporting family reunification, and more. The CSG Justice Center launched Reentry 2030 to support states and spur national movement and attention to dramatically improve reentry outcomes and ensure the successful return of every individual back to their community. Next slide, please. Reentry 2030 has a bold goal to improve reentry success by 30% by the end of this decade and reduce the number of individuals that are returning to prison from supervision. As Megan mentioned earlier, the cost of reincarceration in Midwestern states alone is over $1 billion annually. To be able to achieve this goal, more individuals need access to education, workforce development training, quality jobs, effective treatment, and what we're calling at the Justice Center day one readiness, the tools, benefits, and resources that individuals need to prevent the possibility of cycling in and out of crisis and in and out of incarceration. Things like IDs, access to healthcare, housing, and more of these basic human needs that we know are essential to getting, even obtaining a job and moving along the track to economic mobility. Next slide, please. Reentry 2030 has four core foundational principles. The first being human-centered, making sure that the voice of individuals most impacted by the justice system is centered in reentry efforts, is centered in policy conversations, investment decisions. Also increasing coordination and collaboration across systems and stakeholders. One system, one agency cannot do this work alone, as Megan mentioned earlier. The third is being transparent, creating bold goals around reentry that are publicly measured and tracked so that folks across your state, across the country, can see the progress that is being made around reentry outcomes and where there are remaining gaps and challenges. And lastly, being data-driven, making sure that data is being used across all decision-making to inform what services are scaled, the quality of services, where investments are being driven, and what policy changes need to be made. Next slide. Reentry 2030 seeks to accomplish these principles and goals by helping states and localities clear away unnecessary barriers. Barriers to work, as Megan mentioned, but also barriers to healthcare access, barriers to accessing additional benefits, access to transportation, and so forth. Also, scaling up what we know works in terms of policies and programming and actually driving the money, the investments into those programs and policies that we know are actually working and scaling them up across communities to make sure they're reaching as many individuals as possible. And lastly, using reentry outcome data beyond just recidivism to drive decisions. Often states are using recidivism as the primary indicator of whether their reentry systems are working. But we know just looking at reincarceration is not enough to know whether people are actually succeeding in their communities, whether they're moving along the track of economic mobility and being successful back in their homes. Next slide. So far, 8 states have launched Reentry 2030 thus far. Arizona, Maine, Missouri, Alabama, North Carolina, Nebraska, New York, and Washington. And 3 more states are somewhere in the process of setting up their Reentry 2030 commitment infrastructure and setting their Reentry 2030 goals, including 2 states in the Midwest, Illinois and South Dakota. As you can see here, each Reentry 2030 state has set big, bold, population-based goals around reentry across different domains, housing, health, education, employment, and more, and across branches of government to address all of these goals and help them move and attain progress. We just wanted to share some examples of what goals states have set. This is not an exhaustive list. If you go on our website, which I see Megan dropped in the chat, you will see each state's comprehensive set of goals that they have launched with across all of these different domains. But in each of these states, stakeholders across systems, across branches of government, with the commitment of their governors, have publicly shared these goals and made the commitment to work collaboratively to achieve them. So as an example, Alabama committed to cut their recidivism rate in half. Missouri set a goal of 85% of Missourians having a job within 3 months post-release. One of Nebraska's goals, and we'll hear more from Nebraska shortly, is ensuring 100% of eligible individuals who are incarcerated being enrolled in Medicaid. North Carolina has set a big, bold goal around education to increase the number of high school diplomas and equivalencies and industry-valued credentials earned by eligible individuals while incarcerated by 75%. New York has set a goal of 100% of individuals released having an ID upon release. And Washington has set a goal of 0 returns to homelessness. Again, these goals are big, they're bold, they represent a vision that state leaders are willing to set for their reentry systems, what they want to see their reentry systems to look like in the future. Next slide. Making reentry more collaborative is a central part of Reentry 2030. Bringing together leaders from across corrections, human services, education, behavioral health, housing, and workforce development. We know that departments of corrections play a huge role in reentry, but we believe that a whole of government approach can help a state achieve its goals and help state leaders address their broader societal and economic challenges. Every state agency, every branch of government should see themselves in reentry efforts. And many state and local agencies are often already working with the reentry population, whether they know it or not. Many states that have launched Reentry 2030 have set up or are in the process of establishing statewide reentry councils or commissions at the highest levels of each state agency to facilitate greater collaboration and to make sure that the state is held accountable to the goals that they've set through Reentry 2030. Next slide. The CSG Justice Center is providing technical assistance at varying levels to Reentry 2030 states. In some of the Reentry 2030 states, our team has been providing on-the-ground intensive technical assistance, helping states develop their strategic plans, conducting comprehensive system assessments, identifying policy solutions to remove barriers. States are also engaging in peer learning through Reentry 2030, where they're bringing together state leaders, local leaders on shared learning topics or around shared challenges. And there are a number of other ways that Reentry 2030 can benefit states. One is increasing visibility and recognition for wins. We often know that corrections or public safety systems are in the media, are receiving attention for negative reasons, often for incidents or challenges that these systems are facing. But what Reentry 2030 does is it can increase visibility for positive things that states are doing, for improving reentry outcomes, for establishing new programs, for identifying priorities to help individuals successfully reenter into their communities. And we help states elevate those wins and share them more broadly around the country. Additionally, generating momentum. As states are accomplishing or making progress on their Reentry 2030 goals, we're helping states continue and build on that momentum to move on to the next goal, to help them achieve even more progress and sharing that again more broadly across their states. And we're trying to help states maximize future investments around reentry, sharing their reentry wins, their reentry progress with state legislators, with other state leaders, with philanthropic leaders to help increase investments in what we know works in reentry in their states and beyond. Next slide. We also wanted to take a couple of minutes to share some of the accomplishments or successes that Reentry 2030 states have achieved thus far in the short time that this work has been underway. And again, as I mentioned a short time ago, we do have a fantastic representative from Nebraska that I'll introduce in a minute, who's going to share more about Nebraska's progress shortly. Here our example is North Carolina. North Carolina developed a comprehensive Reentry 2030 strategic plan with key activities and objectives and performance benchmarks. And then they created a first of its kind data dashboard that helps the state measure progress, track their progress around these benchmarks and goals, as well as helping them hold themselves accountable. And we can drop that link in the chat as well. Next slide. In Alabama, the legislature a year ago passed two critical reentry bills. The first created a statewide reentry infrastructure, the Reentry Commission, which is a cross-agency collaborative body to support reentry and to move forward on Reentry 2030 strategies. And the second bill that passed that session was to remove unnecessary barriers and expand pathways to employment for people with criminal records. The state has also recently broke ground on a new reentry facility, the Care Center, which is designed specifically to support women that are returning to their communities from incarceration. Next slide. Here we have some additional examples of state successes. We have more on our website that folks can take a look at. But Missouri, another Reentry 2030 state, now, it was actually our first Reentry 2030 state, now has fully operational reentry centers in every single correctional facility designed to support with warm handoffs, making sure that folks are connected to the needed services and supports in the communities that they're returning to across the state. New York and North Carolina are expanding housing options for individuals returning to their communities, launching new transitional housing programs, creating dedicated statewide housing positions to better focus intently on this priority. And Washington and New York are just two examples that have measurably increased enrollment for eligible individuals into Medicaid in the last 2 years. So I'll stop with the presentation. As I mentioned, we want to turn it over to a critical partner of ours in the state of Nebraska to share more about the progress and work that that state has been undertaking over the last couple of years since launching their own Reentry 2030 initiative. Steve Fannin is joining us from Nebraska. He is currently the Assistant Deputy Director of Reentry for the Nebraska Department of Correctional Services. Since beginning his career at NDCS in 2007 as a correctional officer, he has built extensive experience in correctional operations, programming, facility leadership, and reentry services. And we're really excited that Steve is able to join us from a Reentry 2030 state from the Midwest to share more.
Thank you so much, Nina. As said, my name is Steve Fannin. I'm with the Nebraska Department of Correctional Services. I came into this role a little less than a year ago to lead our agency's reentry services division. And while we all know that reentry is at the heart of everything that we do in corrections, my division primarily focuses on our daily work on a couple of key initiatives. We do individualized reentry planning services, providing comprehensive reentry planning for every person prior to release. We have a division of vocational and life skills programming, which is legislatively funded grant subaward partnerships with community partners who connect with individuals during incarceration and keep those connections post-release to help individuals navigate the reentry transition over that 18 months post-release period. And most recently, we've adopted a career services division, which not only provides direct client services in employment preparation, career mapping, confidence building, but also incorporates direct employer engagement and second chance hiring, education, and advocacy to build partnerships and help connect employers with a very talented, skillful, job-ready workforce. And in doing this work, I'm incredibly fortunate to work alongside an incredibly committed and passion-driven team within our reentry teammates who are exceptionally talented experts in this work. A little bit about how we came into Reentry 2030. In 2024, Nebraska became the fourth state to join the Reentry 2030 initiative. At that time, our agency had a lot of really good things occurring. We had robust programming opportunities, clinical treatment, education, religious services, and our dedicated reentry planning division. It wasn't so much that we were lacking good programmings. It wasn't so much that we were lacking good programs or good opportunities. It was that we were lacking integration. We had excellent people doing excellent work every single day. But as was mentioned, often that was done in silos rather than collectively coordinated together. Reentry 2030 gave us that framework to align the efforts towards our common shared statewide initiative goals. Along with Reentry 2030, we prioritize two parallel initiatives that are kind of key drivers in what we do with Reentry 2030 goals. The first being our Transform Nebraska Network is a statewide initiative that brings together employers, state agency executives, community organizations, faith groups, and community partners with a shared responsibility and commitment to second chances and successful reentry. These partnerships, they really demonstrate and solidify that reentry success is extended beyond the responsibility of corrections and the Nebraska Department of Corrections, that we're collectively responsible and requires that shared commitment to change involving the whole community. The Transform Nebraska Network is not a think tank of theoretical ideas. This is a job site. We're hard hats on, sleeves rolled up, tackling the hardest barriers to successful reentry, and we're doing it together. The second parallel initiative was our 5-key model for reentry and well-being development. This was created by Dr. Carrie Pettis with the Wellbeing and Equity Innovations, WEI. This model identifies 5 areas of an individual's life that are important for well-being: healthy thinking patterns, effective coping strategies, positive social engagement, positive relationships, and meaningful work trajectories. This framework, which everything we do is built into, it's how we help people make positive change. This approach is largely client-driven and focuses on strengths and skills of the individual and the individual's innate ability to create solutions for their needs rather than deficits and risk-based exclusively. Along this journey, we've also had some really key legislation that's passed. Very shortly after launching our Reentry 2030 initiative, Governor Jim Pillen signed legislation that reformed our state licensing laws for people with criminal backgrounds, ensuring that the criminal record needed to directly relate to the license in order to disqualify people from licensure. This opened up pathways for individuals who met qualifications, had talents and abilities in that field to have an access and a pathway to apply, interview, and be considered for those jobs otherwise previously disqualified from. And then more recently, LB 631 did a number of really positive reentry things, but to touch on a couple of them, one, it created a state appointment reentry continuity advisory board, which included leaders from corrections, our parole board, probation administration, community support organizations, and individuals with justice involved lived experience to help steer some of those statewide initiatives and be an advocacy between community and policymakers to affect positive reentry. Another aspect of that was creating statewide standards for transitional living facilities, providing transitional housing and funded through state appropriations for people leaving incarceration. In Nebraska, we've been incredibly lucky to have a very engaged and supportive reentry community, especially our legislative community that have been helpful in driving meaningful and responsible change to continue our reentry success. So as we built this collaborative framework, we started noticing tangible changes taking place across Nebraska. A couple of our deliverables that we've worked collaboratively with other state agencies, community stakeholders, representatives with lived experience include, we implemented a MOUD, medication for opioid use disorder treatment program, again, to reduce mortality risks, especially for individuals during that pivotal reentry transition period. We've collaborated with the DMV. We've always had a process in place, collaborating with the DMV to provide state identification for people returning to the community. But we've recognized that we can remove another barrier by maintaining eligible and maintaining a valid driver's license for individuals during incarceration. Oftentimes navigating, that the only barrier being the expiration of the time and their inability to do so during incarceration, to continue that status so that it doesn't have to start over once they're released. We're piloting a support for families curriculum. So providing programming support and immediate resources for immediate family members and positive support of incarcerated people prior to their release to help ease in that transition period. We recognize that family is one of the biggest sources of support for an individual during that transition period, but that their absence, has created disruption affecting the family, and that reunification point, has expectations and is a disruption of itself, and how to ease that and make sure that both the family and the individual are successful and going along the same lines. We've expanded our multicultural collaboration. We've always been very fortunate to have very committed volunteer groups within our system, but we recognize gaps and meaningful gaps in underrepresented specific cultural and identity populations. And so we've very strategically coordinated interactions with groups in the community. And what we found was that groups were interested in wanting to help and participate and be involved, but we're really just waiting for that call to action and waiting for somebody to reach out. And so we've built some tremendous relationships over the last year with a lot of partner organizations in the community that we otherwise did not have direct tie-ins with. And I also want to touch on our employment engagement opportunities through the Transform Nebraska Network. We have a very specific workforce group. CSG has been amazing partners in helping us increase employment opportunities. Some of the goals that we have been driving towards include expanding second chance hiring within state government itself, opening positions within state agencies to people with criminal backgrounds, building direct pipelines from our in-prison programming and treatment, and training opportunities to specific Nebraska and local employers, building apprenticeship opportunities, and developing those employer champions across industries across Nebraska. One of the greatest lessons we learned is that corrections cannot own reentry by itself. We may own incarceration and we may do that really, really well, but successful reentry requires employers, educators, healthcare providers, housing partners, and the community who are all part of the solution. Everything I've discussed today is replicatable. It can absolutely be adopted by any state. In Nebraska, we don't claim to have all the answers, but what we've learned along the way is truly that lasting change comes when agencies stop working beside one another and we start working together with one another. And in Nebraska, Reentry 2030 wasn't about creating another program for us. It's about creating a different way for all of us to work together towards common and shared goals. 2030 has challenged us to think beyond incarceration and focus on accountability, opportunity, and to challenge the status quo. Every initiative, from legislative changes to workforce partnerships, family engagement, is connected by a common purpose of helping people return to the community better prepared to succeed. We're proud of the progress we made, but we know that we still have a lot of work to do. This is a journey and we haven't reached the destination. We appreciate our opportunity to share our experiences with you and look forward to continuing to learn alongside you. Thank you.
Thank you very much for your presentations, Nina and Megan and Steve. Thank you for sharing how Nebraska has benefited from joining the Reentry 2030 initiative. With the help of our CSG staff, I am now going to moderate this Q&A portion of the webinar. If anyone that is here today has a question or a comment, please feel free to raise your hand or type a question into the Q&A feature. We heard a lot of wonderful information about Reentry 2030. I learned a lot, and I also see that Ohio is not a part of this, so I really want to look at how we can join the effort because I know in Ohio we are doing a lot of things, but it's just really not kind of coordinated effort under the Reentry 2030. So I think this is a great opportunity for Midwestern states to be connected and to be on the same page as we move this policy, very important policy initiative forward. So with that being said, I just wanted to open it up for questions at this time. Laura, do we have any questions that were typed in, or does anyone have any questions that they'd like to raise their hand and ask at this time of our presenters?
I believe Senator James had a couple questions to start us off.
Okay. Senator James?
Yes. Thank you, Senator Reynolds. So a question for our panelists, and obviously I'd love to have Megan and Nina come to Wisconsin, but if a state was interested in, introducing this Reentry 2030 program, what does that look like and who initiates it? Is it the legislators? Is it the governor? Is it the DOC? In Wisconsin, we have divided government, so sometimes we don't want to give the win to certain people, and that's a barrier that does exist. I will be real about that, but we're able to get some good things done with the 1115 waiver. That was a bill that I did, and we got it passed to help with those individuals, because our county jails were doing it already and really taking up their own funds for it, and to try and get some of that reimbursement back from the federal government was, I think, very appropriate. And then now we have the opportunities for our individuals in the prisons to become bachelor degrees. They can earn their bachelor degree. A lot of them are earning their certificates and associate's degrees, but now they've partnered with even our local university, UW Stout, with the Stanley prison, which is very nearby in my district, where they finally had somebody earning bachelor degree level stuff. So there's great things happening, but how would we get this initiated in our state? And then the second part is how much funding is tied to this effort? Because I looked online and I cannot find any kind of dollar amounts. So I look forward to your response.
Yeah, no, thank you, Senator James, for that question. I can start trying to answer that. In terms of how to start, every state has started their Reentry 2030 initiative very differently. Um, it can start with a Department of Corrections, it can start with a legislator, it can start with the governor's office, it can start with a local jurisdiction who is interested in thinking about reentry differently and elevating it to the state level. There isn't a cookie cutter approach. It has started very differently with different people in each of our states. Some of the commonalities are things that we look for as states are seeking to launch Reentry 2030 is commitment from high level leadership. Early on, that took the face of governors coming out and being public around Reentry 2030 goals and putting their weight or commitment behind Reentry 2030 alongside Department of Corrections and other cabinet level agency. I think because of politics, because of each state's different political context, election season, I think that has looked very differently in some of our newer states. Um, but seeing high level commitment from multiple agencies, as we have been talking about, it's not just correction. So we want to see multiple agencies coming to the table and being bought in to the concept of Reentry 2030 as an umbrella or an organizing framework for a new vision for reentry. So that's kind of one of the first pieces is making sure that there is buy-in from across different systems. And then engaging in conversations with our team. When states express interest in Reentry 2030, we have those initial conversations to better understand the state's current priorities around reentry, where they're experiencing challenges. And then we help states set their Reentry 2030 goals. That's really the first step, is organizing a state across systems around bold goals that everyone can get behind. And then kind of going from there. So it starts very differently, but happy to have conversations with any state that is interested, and then we just keep adding folks to the table and to the conversation. As you see from the list of 8 states, and then the 2 or 3 new states that are going to be coming on board in the next several months. We've worked in states like Alabama, and we are working in states like Maine and Illinois, right? So this is not a partisan issue. We have been working deeply on these issues in red and blue states and in states that have divided government and folks that see reentry from different lenses. But ultimately, everyone can see the benefit of most of these individuals are coming back to our communities. So how we address them is really important. In terms of funding, that's also looks very different in each state. I mean, the way the Justice Center is funded is through private philanthropy. Originally, Reentry 2030 was launched as a Department of Justice BJA partnership. Since then, we have also been partnering with philanthropy, and we're partnering directly with states. States are seeing that a lot of this work, and Steve mentioned this in his remarks, this is not a new program or something added on to the work that states are already doing. So in a sense, it doesn't necessarily cost anything. This is a new way of looking at reentry. This is a way of organizing already existing reentry efforts under one vision, one umbrella, and really value statements around how the state wants to address this population. But we're also seeing states find different ways to invest in reentry efforts and invest in partnerships with additional community-based organizations, with CSG and with others, whether that's private philanthropy. So for example, in North Carolina, they have a regional or state-based funder, the Z. Smith Reynolds Foundation, that is investing in Reentry 2030 work. In other states, folks are looking at different state dollars, opioid settlement money, because again, as Megan mentioned, a lot of this population finds itself in needing substance use treatment, kind of cycling in and out of crisis with substance use issues. So other state types of dollars are being utilized to support these Reentry 2030 efforts. But it's a mixture. It's a mix of government money, local philanthropic or state-based philanthropic dollars, national philanthropic dollars, as well as federal dollars. We know that BJA has been putting out solicitations again more recently, a lot of them focused on reducing recidivism, reducing violent crime, addressing public safety issues, and obviously this population falls squarely into that work as well. I don't know, Megan, anything that you wanted to add to that?
I think I'll just add on the funding piece. What we're also seeing is with other state agencies seeing the reentry population as part of their population, you end up having dollars prioritized for them. So, for example, Health and Human Services has always supported people with serious mental illness, right? And yet now being able to identify, well, we have a lot of people coming out of jails and prisons with SMI. How can we be supporting them from day one using Health and Human Services resources, right? How can they be prioritized for this population, knowing that they fall within this broader population and might not have been prioritized previously, and not have been connected day one on reentry. And so I think we're seeing that happening a lot across the country, Reentry 2030 states, as with the involvement of some other state agencies, starting to figure out how can I step in day one or even pre-release to start supporting this population that is a population that we would typically be serving.
Great. Yeah, that's wonderful. Any other questions that we have from members of the audience attending? Really good.
Yes, we have one, thank you, Senator Reynolds. We have one from about targeted research or programming for those re-entering who are on the sex offender registry list. Understanding how these offenders who will be released are being rehabilitated, prepared for re-entry, so to reduce recidivism are being unable to succeed. Are there any targeted research or programming on that?
I can jump in. So there is research on specific treatment programming that works for people with sex offense convictions, and happy to share some of that research and resources directly if that's helpful. I will say more broadly that sex offense conviction is probably the biggest barrier for reentry when it comes to consequences related to housing and employment. It is consistently brought up in every single jurisdiction that we work with as being prohibitive to find a place to live and to find a job, regardless of the severity of the sexual offense, and ends up consistently because of housing restrictions resulting in homelessness, and then people being reincarcerated due to that experience of homelessness. I think that's a pretty consistent experience that we see across the country. And so I think it's a particular need that needs to be addressed from a barriers perspective as well, to say, how do we remove barriers for this population to be able to find access to housing and employment so that they can be successful upon release. One of the things we talk about in 2030 a lot is how do we remove barriers so that day one someone has the opportunity to be successful, right? But if we're already setting them back 50 yards behind the start line, we're setting people up for failure. So I think that's a population in particular where legislation is critical to be identifying how can we remove some of those barriers for success.
Great question. Any other questions from members of the audience for our panelists?
Megan and Nina, do you have statistics on all these things by state so that if a state is interested in looking, where should they start? What are some of the key issues or that kind of thing that they would be able to see that, or would you do that upon them asking if they might pursue the possibility of being a state that does this project initiative?
Yeah, so I think both. We do have some resources on our website that provide state level data analysis. One that we mentioned is around cost of reincarceration and recidivism rates. But we also produced, I wouldn't say they're slightly old. I think it's about a year or so dated, but state playbooks or state analyses where we did analysis around reentry outcomes, around collateral consequences, around crime trends, and so forth. That for each state, and so that is available on our website as well. But a lot of that work is what we do when we partner with states around Reentry 2030 and our system assessments. It's engaging in listening sessions, focus groups, interviews with basically everyone involved in reentry systems to better identify like where are the current gaps, where are successful programs or practices happening, what are the barriers and challenges that systems and individuals are facing. We look at data around not just recidivism, but supervision and reentry outcomes, violations of supervision, and so forth to better understand what populations, where the geography wise folks are returning to, looking at labor market trends and how to align employment opportunities and training with labor market trends. So a lot of that data analysis and work is what we do when we partner with states as well, but some baseline data is available on our website.
Great, thank you. We have another question from an attendee about um, prescription medications and specifically wondering whether any states have adopted best practices in making prescription medications continuity a policy priority and how have they done this. They commented that many individuals leave incarceration with medications for chronic conditions, mental health, substance use disorders, but then they face barriers to obtaining refills because they don't have a physician or they can't get a timely appointment, that kind of thing. Do you know of any states that have done something with that issue?
Megan, I'm looking at
Yep.
you for the
Yep.
flood.
No,
Yeah.
I'll jump in here and I'm going to tie it. Also, there was like a local question. So I'm going to try to tie these two questions together. So, yes, I think it's part of a much bigger like health related goals. And so I think oftentimes we're seeing states set goals around Medicaid enrollment prior to release or health insurance enrollment prior to release. So saying, how can we ensure that people have insurance before they're released or upon release so that they can maintain that medication when they're released into the community. I think that oftentimes is inclusive of medication. So we do have states that say they want to increase the amount of time that they're giving or they're releasing people with medication. So some states might have started. I know in one state we work in, they started with just 1 week and now they're up to a 30-day supply of medication upon release. Through Reentry 2030 states also kind of set their public goals, but they might also have other goals that they've developed through their strategic plan, where they're working on some of this through that collaboration across services. One place that we see this specifically is with MAT, medication assisted treatment, for opioid use disorders. And so part of that is both, is MAT being offered in prisons? What options are there? Can you expand options across different facilities in your prisons? Then it's about what options exist in communities. Is it specific to urban, rural areas? How can you expand options for treatment and telehealth treatment in some of your more rural areas and in-person treatment because we know how important that is. And then it cycles back to local jails, right? Are local jails offering MAT? How can we build out MAT programs inside of local jails? And so it becomes across the criminal justice spectrum, how can you build out this process so that as people are cycling through, they're having continuity of care with the same options that they were given across a spectrum that work for them. I'll just note, kind of tying it to the local question too, Reentry is a local issue. So as much as we're saying you need statewide coordination, there has to be a connection to what's happening at the local community level. And so what's happening around collaboration that's bringing folks together across these same sectors at the local level that includes people with lived experience and includes community-based organizations. And if there's something proven that's working on a small scale, how can it be expanded? Can more people access it? And I'll just make a quick note around housing there. I think housing is one of those issues that we tend to really struggle with statewide coordination. But then when you have the local housing providers really present, that we can really look at how can we reprioritize some of these housing vouchers or change definitions so that as people are returning home from incarceration, they're actually eligible to access these same services that they historically haven't been able to because incarceration isn't often thought of as an experience of homelessness. And so I think that local state coordination is key for states to be successful.
Megan, I could also add that in Nebraska, every person who's releasing from our agency receives 1 month of prescription medication for any prescription that they are prescribed at the time of release. They get that as they're walking out the door, along with 2 free refills in the community available to them as well. If anybody's interested in how we operate that, I'm more than happy to share. Please reach out.
Wonderful. So we are going to take just a couple more questions. And I do believe we have a few, Laura.
Yes, we we have two questions. One is if you provide assistance for any kind of proposal that is making reentry more difficult, perhaps trends or legislation, can you provide help to address those issues?
Yeah, I can take that one. So one thing that we're always happy to do is provide state policymakers with information and data. We do a number of different types of briefings, one-on-one conversations to share information around best practices, research-based approaches, state-specific data, to share information with legislators around these topics. We always want legislators and policymakers to make data-informed, research-based decisions. And so we are happy to engage in any conversations with folks around these topics, and happy to review legislation as they're being drafted, but more generally, we engage in conversations, briefings around these topics to help inform and make recommendations around alignment with research and best practices. So happy to do that.
Right.
What else do we have?
Did we have I think one was answered in the Q&A. Megan shared a resource, expanding access to public employment. There was a question about action states have taken to expand access to public employment for folks with criminal records. And so everyone, if you could check that, if you would like to check that resource, it's a publication from the Justice Center. Did you want to say anything else about that, Megan or Nina?
I don't think so. I mean, I think there are a number of different ways outlined in that publication, and there's a lot of examples that we can share as well from states that have been working on this. I know Steve mentioned Nebraska has been working on this issue as well, so happy to follow up with folks uh, for that. And I can share our contact information or my contact information in the chat so that folks, if they have additional questions or want resources or would love a state briefing or conversation with policymakers, we're happy to engage in those conversations.
Wonderful.
It's wonderful. Any other questions?
I think we've wrapped up. If I don't know if there's I didn't mean to avoid the local municipalities issue, but Megan, I think, answered some that somewhat about steps that localities and municipalities can take to support reentry. Also, Nina had said that even reentry 2030 initiatives can start at the local level. So, is there anything more you would like to add to that, any of you all, about local involvement?
I would also say that when we talked about statewide reentry councils, we see a lot of localities establishing local reentry councils to better coordinate services across systems at the local jurisdictional level as people are returning, making sure that services are coordinated, not duplicated, that people know where to go when they are being released. So we have a lot more information on local reentry councils, but that's a great way for localities to start thinking about reentry, bringing together local agencies with law enforcement, community providers, et cetera, to talk through local reentry issues. That's a great way to start.
Okay, well, with that being said, there are no additional questions. I'd like again to thank our panelists, Nina Solomon, Megan Pfeiffer, and Stephen Fannin, for your presentation and insights. And I will now turn this over to Wisconsin Senator Jesse James.
Thank you, Senator Reynolds. Just a few quick notes before we end the webinar. First, resources from this webinar, including a recording and a PDF of the presentation, will soon be made available on the CSG Midwest website and the site's events page for the webinar. You can navigate to the events page at csgmidwest.org. If you ever need assistance on corrections and public safety issues or have ideas for the MLC Corrections and Public Safety Forum, please contact Laura Cleaver, staff liaison to the forum. Lastly, the Great Lakes St. Lawrence Legislative Caucus, along with the MLC Committee on Environment and Energy, will be holding a webinar next week on July 24th. All are welcome to participate. And if you haven't registered for this year's MLC annual meeting, we hope you'll do so very soon and join us August 30th to September 2nd, St. Paul, Minnesota. In the meantime, thanks to all of you for joining the webinar. I hope you have a great rest of your day.